we are exposed to different abnormalities throughout our life. We keep accumulating those things and finally they manifest. The regeneration powers are very low in neuro. So once lost is lost. There was a misfolded protein accumulation in brain that both in case of Parkinson's and Alzheimer's. In Alzheimer's, that is amyloid beta protein, and in Parkinson's, that is alpha synuclein. Along with that, there is tau proteins. These things. So 35 years, more than 35 years is considered as now we are in the process of aging.
Tell us a few factors that can influence this kind of lifestyle to balance this.
Number one thing is diet. There is no age group which will not need a good sleep.
Hello and welcome to the Decoding Phase Transitions, the DPT podcast. I'm your host Sananda Biswas, and here we decode the career phases of brilliant minds in academia and beyond. Before introducing today's guest, I want to mention something personal. Over the last few years, I have become fascinated by how brain works, how memories form, and what happens when the delicate connection between the neurons inside our brain slowly begins to fail. My own training is in physics, but today's guest works at the front line of understanding some of the most complex neurodegenerative diseases that affects human life. And today's guest also happens to be my school friend. I'm happy to introduce Dr. Aritri Bir, a medical doctor, researcher, and educator specializing in biochemistry, neurodegenerative diseases, and muscle degeneration. Aarti completed her Bachelor's of Medicine and Bachelor of Surgery (MBBS) from Medical College Kolkata, followed by an MD in Biochemistry from the Institute of Postgraduate Medical Education and Research, Kolkata. She later earned a diploma in National Board (DNB) in Biochemistry, where she was awarded the prestigious President's Gold Medal for Academic Excellence. Over the years, she served in several academic and medical institutions, including IQCT Narayana Multi-Speciality Hospital, Durgapur, MGM Medical College, Kishanganj. Currently, she is an assistant professor at the Dr. B.C. Roy Multi-Speciality Medical Research Center at IIT Kharagpur, where she continues her work bridging biochemistry, medicine, and research. In this conversation, we not only focus on her career journey through medicine and research, but also the science behind some of the neurodegenerative diseases such as Alzheimer's and Parkinson's disease. We discuss how neurons become gradually damaged, the mitochondrial pathways, and how the lifestyle choices made today can affect the brain health decades later. Aritri also explains the warning signs people should pay attention to, how stress and hormonal balance affect long-term health, and whether activities like reading, writing, and mental engagement genuinely help preserve cognitive functions. Alongside the science, we also talked about her career journey, how she decided to pursue medicine, the challenges of medical education, the roles of mentors and family, and the critical decisions that shaped her career path. And towards the end of the episode, she also shared her thought on using AI for medical education and healthcare services. What comes across strongly in this episode is the idea that medicine is not about treating diseases after it appears, but also about understanding how everyday choices in life can shape the future of our body and brain. So, without further ado, here's my conversation with Dr. Aritri Bir on the DPT podcast.
Welcome, Aritri. Thank you for coming here today to our podcast, Decoding Phase Transitions, the DPT podcast. We are very glad to have you here today.
Thank you, Shananda. I am also very much excited to be here. Thank you for calling me here.
Thank you. It sounds though very weird to call you Aritri. I never call you Aritri, and because we are school friends, we always call you Ori. Though our Bengali teacher told us it means something else, not a friend, but an enemy. But anyhow, I might address you Aritri, Ori, and it might switch between these two. Let's go to our journey together back in our childhood. So let's talk about your childhood a little bit. As far as my memory goes, I think you were always interested in medicine, and you were very clear from the beginning that you wanted to be a doctor. share with our listeners what was the story behind your motivation and how can a 10-year-old become so clear about her career journey ahead?
Actually, for me it was very easy because I'm a second generation doctor. So my father was a doctor. My father is a doctor. So seeing him working in the healthcare field, along with my mother was there also in nursing professional. So the household runs around the healthcare facilities, and a lot of time in their discussions, I was the passive part of their discussion, the well and good listener. And there were many queries which I used to ask my father, that what is this, what is that, like that. So these are the things which grew interest in me, that yeah, I want to pursue medicine, I want to be a doctor. Yeah, at that time the vision or the pathway was not much clear. I just knew that I want to be a doctor, and what were the things required, that I mean discovered in the process. So that was the first thing which happened in me. But yeah, when I grew up, I came to know different pathways of being, I mean, what can be. Because, we grew in India, in West Bengal. So there were at that time the state-wise entrance examination for medicine, and the all India, and along with individual, medical colleges used to conduct. So those pathways were later clear to me.
Did you find, like, when you came into this field later, were any surprises there? Like, what was the biggest surprise that, because all along your life you knew that is your path, but what was the biggest surprise? Maybe the biggest one you can share, that even though you are prepared for life, for this career, but I guess life is with very many surprises. So was there any biggest surprise?
The biggest surprise, I will say, the thing I came to know, that I used to think I am a very smart and good student. Then when I entered the college, I realized that there are students who are not less smart than me, if not smarter. And then I came to know that the syllabus or the pathway is the smartest amongst us. So how much smart and good student you were, the journey was tough, hectic, but definitely, it was enjoyable, and the whatever troubles we had at that time was worth taking. So that was a
That's
surprise, that everywhere I'm seeing the smarter students around me.
Yeah, that's actually, somebody said, no, then this is I'm paraphrasing, that if you are the smart person in a room, then you are in a wrong room. So it actually proves that you are
True,
going in the right
true.
path. Let's go back also a little bit to your schooling, to your childhood. What impact your family and your teachers or mentors had in your life that had a long lasting effect later when you were faced with many challenges?
Honestly, in West Bengal, at our time, the greatest challenge was for me to get adapted with the language. I studied in the regional school, Bengali medium school. Yeah, I had in my home there was a teacher, my home teacher, who used to come and teach me English from the very, class fifth standard or sixth standard, like that. But that was not the that's a sort of grammatical language training. So, following the classes in English was a bit tough for me in our first year of medicine. But again, in our, you were there, in fact. So in our 11th and 12th standard, there were greater exposure to English language, but that was an impact. A few teachers used to teach a good English. They used to guide us in, even if the classes were taught in Bengali regional languages, they used to give us, at least give additional help to how to proceed in English. If I want to proceed for further higher studies. So that was a good impact. Along with that, biology and chemistry, they were my good choices of life. So in fact, it was my second choice that if I am not a doctor, then I had to proceed through the chemistry line, biochemistry or some biotech line. So that was a good impact. And another impact, I'll say, towards my life of medicine, one incident happened that my grandfather passed away at my 12th standard. That was not a happy thing, but again, it was a great exposure to me that he had stroke, cerebrovascular stroke accident. So all the care was at our home. So the home was converted to a mini hospital where I participated a lot. I knew this was the scenario of the actual patient care and few decisions. In fact, when my father was outside, I took on behalf of him, very basic. But that was an impactful journey. That 6 or 7 months.
I can totally understand. Two things for the listeners I want to mention here, that you told us that when you went to college, the challenges you faced with the language a little bit, because this is not known to everyone perhaps. So we went to the regional language school where we were taught in Bengali. Everything was in Bengali: biology, math, physics, chemistry.
Physics, chemistry.
And then the way the board runs is that when you go to higher education, you go to college, if you specialize in any subject, like in your case, medicine, in my case, it's physics. So we have to learn everything. The books were suddenly in English, and we have to learn everything in English, and and also give the exam in English. So this is a big transition for us, and that I think what the challenges are for everyone who is coming from this Bengali medium board to another board. And this is huge. But I also remember what made a little bit the journey easier was this thing that you were talking about. The teachers helped us, but the books at that time in 11th and 12th standard, they were also coming with, if there is a sentence and one concept is introduced, then there will be the English translation will be in bracket along with the Bengali. So that actually helped to put us a little bit of pointers later that, oh, Onughatok is catalyst and things like that, like otherwise we would be totally lost if it were that connection were not there. So I think that's also a smart approach who were writing the books, that they came up with this to make the journey a little easier, right?
Yeah.
But you told us a little bit about this, the experience with your grandfather, and you taking little decisions here and there, medical and caregivers' decision perhaps are also advanced decisions. What were those, and how did you get the confidence to take those decisions at that time, being only 16 or 17 years old?
Actually, if I describe the scenario, there was definitely one nursing attendant was there, and there were a bucket full of medicines which was supposed to be given to him. So I used to handle them a lot. I used to read what are the name of the medicines, what actually they do. I used to ask my father, why this medicine is given, what is the function in general, not in a very detailed mechanism, but why these medicines are given, etc. Along with that, at that time, my grandfather was having a peripheral IV line. He had a fast attack. Then he was there at home care. Multiple times, I asked the nursing personnel that can I push the drug through the channel. So she allowed me. My father also was there under his supervision. But when the second attack happened, my father was outside, and our nursing attendant was there. So I called my father, and in phone he gave me the instruction that these are the vials, you need to break them and give them. So along with the nursing attendant, I took those steps by myself when my father was not there. So that was a thing which gave me some sort of confidence that these type of emergencies are not creating panic in me. So
which is a
that
big
was
thing, right? Because it's your own grandfather and you are still not, I think you are on the verge of growing up, but it's like still not adult. It's in that sense, right? To take all these decisions. It's a huge thing. And the confidence it might come from those experiences, it might mean in a bigger way when you actually enter the field, and to actually boost your confidence that that's your path. So that's why I wanted to go back to that story. You were talking a lot about your father, who is a medical professional, but your mother was also in healthcare. Tell us the role of your mother in your life, how her life and how her career choices impacted you and your childhood.
my mother she was a nursing professional. Then she came to that teaching line where she used to teach the nursing healthcare professionals. Later on, she held the position of principal as well. That was her journey. But what inspired me or influenced me, in fact, was how she used to manage everything after being on your toes during her duty time, which was a fixed time. After that, she used to come home and handle all the things. So that again was a good thing to let me know that everything can be done. Again, she gave me the confidence that, not a big thing, that handling the healthcare, along with that coming home and taking care of everybody, was not a thing where you can just get confused or you are clueless. So that's a smooth thing if you manage it properly.
Basic but very important education for at least, also to give context that when we were growing up, when Ori and I were growing up in that surrounding, a lot of women are not into workforce. So a lot of them, they were caregivers at home, they were homemakers, but most of them were not directly in the workforce. And seeing your mother firsthand to handling both, having a career, having a home, having a child, must have given a wonderful example how to lead satisfying and successful career, right? Let's go to your medical career journey. So you chose to do MBBS, which is Bachelor of Medicine and Bachelor of Surgery, right?
Yeah.
So when you leave school, so there are some entrance exams that you mentioned you had to clear, and which is very competitive, by the way. And coming from a culture where only medicine and engineering are considered the prestigious back then, it was more competitive because people were pushing every kid, I guess, to that direction. If you have taken science, which we had to take after 10th standard, after 10 years in school, the last 2 years, 11th and 12th, were specializations in the sense that either science or humanities, whatever direction, and commerce. These are the three possible directions. But let's come to the competitive part of it. And there is a rigorous preparation, I think, for 2 years. You have to prepare and then give these exams. Tell us a little bit about what that preparation looked like, if you remember anything. I know it's a long time back, and anything specific that you like to mention for our young listeners who are maybe preparing for these exams today.
Actually, when we appeared, for in our time, there was state entrance examination, as well as the different states were conducting their own state examination. Along with that, there were all India examination. Apart from that, institutions like AIMS, institution like BHU, Zipmar, they used to conduct their own institutional examination for entrance.
But these are national level examinations. AIMS was national level examination.
Yes, right? Yes. That was open to everybody. But that is only for AIMS. For state board examinations, they used to conduct a common entrance examination, joint entrance examination. That was in West Bengal. That was for the 7 and 8 medical colleges at that time. Based on the ranking, you can choose your college. But
give a perspective. Do you have the numbers in mind? Like these many colleges, 7 and 8, and How many seats were there in total?
We grew up in a very traditional and conventional way where students who are taking science, everyone used to appear in joint entrance examination, which was a common entrance examination for medicine as well as the engineering. Yeah.
I am the exception. I didn't give.
You didn't, right? Good. That is the thing, because of very few people used to know what are the alternatives. In West Bengal, the scenario was, I mean, very focused on joint entrance examination, where if you do not do MBBS or engineering, the life is lost. And thankfully, you established the alternative, which is a good example.
No, because I had a wonderful supportive parents. So I told my parents when I was in 11th that I think my interest is in physics. And my father immediately said, then there is no, if you are not going to study engineering, if that is not your interest, which was not, then he said, why should you appear for this? And I think that support at home, it meant a lot at the time, which I later understood because everybody else at their home was pushed towards it. Like they were forced to either appear for medicine or engineering, and as you said, like life is over if it doesn't happen. That's the environment was like that. It was too much.
And that was a bold decision from your side. Yeah, I must.
Yeah, but I was not alone in that decision. I think if I hadn't had the support and confidence that were given to me at the time from my parents, I wouldn't have been able to continue, because if your parents also say your life is over if you do not choose these things, it can break any child's confidence, whatever they have. Yeah, I was very, very fortunate. Let's go to your preparation. So how did you prepare yourself for this?
Well, the preparation was like, I mean, we used to go to the tuitions, mostly physics, chemistry, maths, and biology. So honestly, I don't remember they were teaching extra. They used to give the effort to everybody, and students were free to take that, I mean, extra effort from their side. So nothing additionally, I think, were taught to us. I mean, these were special courses you need to take. At least in our small town, those extra facilities honestly were not there. But I remember, I know that at that time, many students used to come to the city, Kolkata, for bigger examination, bigger guidance, which somehow I didn't take at that time.
But even without this, you were in top 100, if I remember correctly. Is it true? You were ranked was
73.
73. I still remember somehow some specifics. You were 73 among 500 rankings, perhaps, and that was the allowed number of seats.
In Kolkata, there was 150.
And then consider the number of students who were appearing for it, which tells a volume of a dream, a focus, and a little bit encouragement from the surroundings, how far that can take a student. And obviously, it's your talent, your hard work, everything goes into it. But as you said, there were no specific training that you went through. Till from that small town, you ranked. Actually, from our school, 2 people ranked in the first 100. You and another friend of ours, Shrutika Banerjee. She and you both. I think it should give confidence to any small town people and student that it can be done. And at that time, when there was no internet, not in a big way, and no AI, no other help, you guys have done it. So hats off to that success. After all this, you chose to go to Calcutta Medical College for your MBBS degree. How was the experience like, and what were you learning coming from, if we say still small town, to now a city life, and among the top students of perhaps of that state? So what were you learning? What were the life challenges, and how the whole experience like?
So, as I told you, the first year was honestly where I am exposed to a city life, and I'm outside of my home for the first time. I'm staying in hostels, adjusting in the hostels, chores, and all adjustment with the class timing, doing everything yours, getting done by yourself. Along with that, as I told, being from a Bengali medium school, attending the lectures, the most important part was to understand what is being taught in English. That was a tough thing for me for the whole first year, in fact. So we used to concentrate, me and a few of there with me, we used to concentrate wholly on the teacher's face to actually, it was about not only the function of ear, we are also lip reading what the teachers were saying. So, that was the greatest adjustment for us. And then it got smoother, definitely.
Did you get some suggestions and tips from the seniors who might have
Yeah.
faced
In
a
medical
similar...
college, the seniors were extremely helpful. I will say extremely helpful. In medicine, the lecture classes, which I now understand, I mean, from the very first year, the practicals are more important than the lecture classes. I am not demeaning the lecture classes, but the hands-on thing or the discussions, small group discussions, these are the most important thing. Now, seniors helpful in the way that number one is books. There are endless books in medicine, honestly endless. So in the first year was a 12 months course. So in a 12 months, it's not possible to go through all the books. So they were like, the books you need to choose, the things in individual topics from which books you should read. Then for the first year, then onwards, that was a combined journey in the sense from the second year we are exposed to the outdoors and indoors. So the patients who are admitted, the seniors used to give us the information. They used to teach us, very importantly, they used to teach us in library, they used to teach us in canteen, they used to teach us in the ward. So there was a huge support from the seniors.
So the clinical phase already started from the experience towards it started from second year, or
Yeah,
or you were getting all the information from the seniors only?
No. The ward posting started from the second year. Currently, in the syllabus, the curriculum has already been changed from, I think, for last 6-7 years, where from the very first year, now they are exposed to the wards to different patients. But at our time, from second year, we used to have the ward posting, and that has some gradings for second year, third year, fourth year, but definitely from second year. But yeah, if there is a good clinical case which is admitted, our senior used to inform us. And at that time there was no WhatsApp group, no information system, so by verbally they used to communicate this thing.
So you have to be a lot social also if you're choosing this field, right? No matter what.
You have to talk to the patients. You cannot avoid that.
You have to talk to the patient, but also you have to talk to your colleagues and peers to take suggestions and to gauge their experience and to take in all this information, right? It's you have to be proactive, I guess, right? In that way. So the MBBS degree is for 4 years? 4.5.
At that time, it was 4.5 years.
4.5 years. And right
after
now,
that, right now, I exactly don't know, but there is a change in the curriculum.
Okay.
The timing. And then there is a 1-year internship.
Internship is not included.
Years.
Okay.
So at that time, we had that 4.5 years of lectures, theories, practicals, etc. Followed by used to get provisional license. Then 1-year internship, we used to get the permanent license. Then after that, there are house staff shifts. House staff shifts, previously it was mandatory. At our time, it was optional. Then post-graduation. If anyone wants to proceed for post-graduation, that's their choice.
At the end of the MBBS degree, what are the career options if they start want to start practicing right away? Is it general physician, or because you haven't done yet any specialization, as I understand? Is it
Yeah.
correct?
Yes.
Okay.
So what happened at our time? See, this, the journey is different. The processes used to be different previously at my father time. Then now, during our time, the house staffship was not mandatory. So after internship, you can definitely practice as a general physician. Now, anybody who enters in house staffship, they are posted in a specific department for that's a 6 monthly tenure.
Internship, we understand that you are an intern under somebody or some
Supervision.
hospital supervision. But what is this house staffship? Can you clarify for our listeners a little bit?
Yeah. So this house staffship is basically where, I remember in the internship, as I told you, we had the provisional license. Under this provisional license, we are not supposed to do anything by our own independently. After getting the permanent license, after the internship is over, we get the permanent license. So from that time, you independently can handle a patient. Now,
Okay.
house staffship is it's actually the housemanship. Some many people used to say. So house staff is the resident physician in the hospital. So he was supposed to be there for addressing the in-house patients, indoor patients, when the visiting physicians or senior physicians are away. So those who are admitted, if they need any immediate decisions in treatment process or any immediate procedure, so those things are actually the decisions can be independently taken by the houseman. But definitely, we used to communicate to our seniors by phone or along with the house staffs. Of course, there were postgraduate trainees who used to be present in the hospital. Also, the senior physicians, they used to visit and roam. But anyway, they were supposed to be there for this 12-hour shift. There was a 12-hourly shift.
Okay.
From our time, a few years back from our time, it became optional.
You mentioned that your seniors were very, very helpful, taking you through those challenges, or taking every juniors in that sense to the challenges that they face just after joining the medical college. Do you want to mention any role models or your teachers who were crucial in shaping your career, particularly in those times?
Honestly, to our line, I chose biochemistry, not specifically to this line, but yeah, many of my hostel senior, they were like, I liked them a lot because surviving in the hostel and then surviving in the academics were the greatest support from them, honestly. Because in fact, I remember initially there was no place in hostel. So an additional bed in a room, which has been arranged by our seniors, we used to share, two of us used to share that bed additionally. After I think 6 or 7 months, we got our permanent room to stay. So they adjusted with us, they trained. Initially having the bone set in our hand, we had that in anatomy. So having the bone sets in our hand and what to do with that, that's all. Specific guidance from their side. 2, 3 seniors were there. Then in fact, from third year onwards, I was a roommate of one of my seniors. She was a support system to me.
Sure.
So
Do you want to mention any of the teachers, or do you remember any of them having special capabilities to encourage students, or in a teaching method that was unique?
honestly, I remember a lot. Then
It will be too much to mention. Or...
it will be too much to mention. It will be, not right to exclude anybody, in fact. Because, in medicine, the most important thing is you learn by observing, the most important thing. You can know a lot of theory, you can be perfect in the practical, but when in practice, how to talk to the patients, how to talk to the family members, how to be punctual, how to handle the stressful events, or how to lead a team, how to interact with your seniors, how to interact with your juniors in the team. So those were the things. You can give a big lecture, but in actual practice, how those should be done, there is no rule book for, because every individual person has specific habits or lifestyles. So individually to these specific problems, how can you approach them, how can you handle them, how can you manage the team? These are the things I learned from different people, honestly. I picked different thing. In fact, I now also I do the same thing. That's the thing. That is the real guidance, in fact, in the field of medicine. I mean,
I
beyond the
think in
lectures
any
and
field,
practicals. Yeah.
yeah. Not only for medicine, I think people skill is a big thing in any field you go. Initially, maybe not so much because we are not dealing with patients every day and their family members and caregivers. We don't have that part. But anyway, to be successful in any field, especially in research, also to collaborate, to understand the dynamics of different groups, and to talk to different people for understanding the scientific interests of different people, that's also important. So people skill, I think, which unfortunately we do not learn very young, when we are very young.
Yeah.
But as you said, by observation people can learn a lot of things. And
Yeah.
I think what the young people have to remember, that nothing great can be done if you are centered at a corner, thinking by yourself, doing things by yourself. It's a community, and we have to go out there and talk to people, right? Do you have any other advice for young listeners at this point?
Honestly, the things which I told, that was the scenario at our time. Current scenario from the very beginning, in current curriculum, there is one part that is attitude communication. So these are now the part of the curriculum. But at our time, in traditional curriculum, we used to observe, we had to observed a lot that how our teachers are talking to the patients, because from the second year we are actually in the OPD, or actually in the indoors. So how they are communicating with the patients, how they are communicating with the family members, these are the things we indirectly learn. Now, though it is included in the curriculum, I will advise them that be involved as early as possible. And in medicine, ask as much as you can. The questions can be silly, you ask. And most importantly, another thing is, if you be a part of a team in your early career, what happens, you have a lot of knowledge. You are the brilliant student of the group. But in practice, in a panic situation, in an emergency situation, things jumbled up. So in emergency situations, in hectic day, how you are going to organize the whole thing, or how you are going to lead your team or be a part of the team, that is the matter of practice. Nobody can teach you with lectures, with modification of the curriculum. So you have to be involved by yourself. That is the most important thing.
That's well said. And OPD is outpatient department, is it?
Outpatient department, yeah.
I guess having the degree, once you have the MBBS degree, your journey is not finished. It's basically it's a little bit of a, I don't know. It's a another climb is going to come, because you normally people do after this is MD, right? Doctor of Medicine degree.
Yeah.
So, and in this process, you also specialized among all these things that you had mentioned, all the subjects that you have learned during MBBS. You do specialization in one of them, one of the subject area. Is it correct?
Yeah.
I don't know. MD is kind of a PhD or similar, because it's, you also have to, for academic degree, we do have to write our thesis, and we get to introduce to scientific processes, right? So the MD does the same thing in the medicine field.
Regarding the thesis, yes. There is a thesis in MD or MS, Masters of Surgery or Masters of Medicine, the two things. So there is thesis. But what I found that the difference between the PhD and this MD and MS is PhD is a more vertical approach. I mean, if you start with a topic, you dig more vertically into it. Whereas in medicine, whatever the topic is, I mean, if we talk about pediatrics, maybe your target group is fixed that this is the age group of your patient, but the domain is varied.
Okay.
So that's horizontally spread along with as vertical as you can go.
Okay.
So that's the thing. So
Yeah,
that is
so it's kind of our postdoc and PhD degree combined.
yeah.
Tell us that you went to do MD and your specialization was biochemistry. How did you focus on biochemistry among all these subject
Uh,
areas?
Honestly, I had little vision of biochemistry. So, I chose biochemistry based on the ranking. Based on the available subject in my rank,
Could
I
you please
chose
tell
bio.
us also about this NEET PG that one needs
And
to?
at that time, there was no NEET PG. There was, again, there was a state entrance examination.
Yeah, so
And
tell us a little bit about the transition. So,
yeah,
when you have MBBS degree, what are the mindsets of normally? What are the mindsets of people? As we are discussing, that one can go to a general physician path
yeah,
and be satisfied with that path, perhaps.
yeah,
But there are other specialization if you want to grow and perhaps dig deeper in certain subject areas. You choose different pathways. Tell us a
yeah.
little bit about the choices one can have during that time and what are the exams that one needs to appear for to go to one of these paths.
So, as you said, after MBBS, people, if anybody choose, they can go to the general practice. Now, for the entrance examination for the post graduation, MD or MS, again, there was two, not two, in fact, there was the state examinations for West Bengal, that was CU, Calcutta University's state examination. Then there was All India entrance examination. Apart from that, in southern India, there were, I don't exactly remember the name of the examination. For the southern India's medical colleges, they used to conduct one examination for entrance, where definitely, that was a national level exam. Apart from that, again, institutes like AIMS, institute like PGI Chandigarh, institutes like ZIPMAR, BHU, they used to conduct their separate postgraduate entrance examination. Again, that was open to everybody. These were the pathways for the post graduation. Now, apart from that, which was at that time, people used to go abroad through their entrance examination. That was another pool. And then a very rare pool was there. Honestly, I will say rare. I have seen a very few in West Bengal. I don't know what happened all India basis. A few used to be in the research. They used to pursue PhD or MS, and many used to do hospital administration at that time. The trend came at that time, hospital administration or MBA. So those were very scarce group, I'll say. But mostly
Yeah.
postgraduate entrance was the common thing people used to prepare.
So you also went through one of these
Yeah.
entrance exams, and you said that based on ranking that you can choose certain subject areas. Talk about a little bit of that and how does it impact on the career journey of any medical student? You are not
Uh,
medical student at that time, you are a medical professional by then, right? Sorry for
right.
the yeah.
So actually, broadly, people develop their choices through during their internship journey. That the practice they don't want to do. Most
Okay,
importantly, for me, that
very
was a
important.
important thing that I decided. I will never be in gynae. Yeah.
Mhm.
Gynecology, I will never pursue. Whatever happens, I will never be in gynecology. So the
There is a particular story behind it, or is just a choice?
I didn't like the process, and I will not say that other specializations lives are easy, but I mean the emergency situation of gynae. I mean at night there are emergency and there are mishaps. So
Yeah.
I was not okay with this.
Yeah. The
I
emotional
mean,
impact is also
yes,
it's
yes,
huge, I guess, in
yeah,
certain
yeah.
cases, in
No,
certain
that is
Indians,
in fact,
particular choice.
gynae and pediatrics are the everywhere you go. Gynecology, where you, I mean, obstetrics, most importantly, obstetrics is where you are having more than one life at your hand, and then pediatrics. These two are the most sensitive specialization till
Yeah.
everywhere.
Yeah, and hard. I totally understand. You after this exam, you went to biochemistry,
Yeah.
and then your MD degree was in specializing in biochemistry. What are the research topics that were exposed to back then?
Honestly, I mean, in biochemistry, I mean, in all types of diseases, the blood samples or the biomaterials, I'll say, not the blood only. I mean, every type of samples are supposed to come to your department for the analysis in the laboratory. Now, for this is a general approach from anybody that they can choose anything. For me, the line was not exactly chosen by me. That is the project used to, I mean, that was the running project of my guide. My guide was deeply involved in neurodegenerations, Alzheimer's, Parkinson's, aging disease models, because he was my supervisor.
But then you chose your supervisor, right?
Actually, vice versa. I mean,
Ah,
that's a mutual choice. In fact, I mean, I wanted to be in his team, and he used to at that time. He used to. I mean, there were 1 or 2 months where we all the PGTs and postgraduate trainees. We used to roam around the department to different postings, etc. In the department, there were subdivisions like someone is involved for 2 weeks in hormonal assays, someone is involved in tumor markers assays, someone is involved in routine biochemistry of everyday's routine biochemistry. So these are the, I mean, roster wise division. Someone is attending the OPD based blood collection and they are reporting like that. Apart from that, we all had our thesis where we had to work. So initially in this 1 or 2 months, we used to, in a team, we used to do all the duties. We used to observe all the procedures. We used to attend all the practicals, etc. Now I understand we used to be observed by the teacher pool, and we had our choices that I want to go to this team. And but that of course the teachers were the team who used to choose these two will be under me, these two will be under me. Thankfully, my choice and his choice were mutual.
okay, very
Yeah.
nice. And your interest in neurodegenerative diseases or the topics for your research topic, it was because of your supervisor's area of specialties,
Yeah,
right?
he gave me the freedom of watching before choosing me. He gave me the freedom of watching what the existing lab mates are working. He had a pool of PhD students also at that time. They were working in different domains, so I used to be a part of all the teams in different procedures. Then I got my interest in neurodegeneration.
What was your thesis about, and when did the idea of going to research occur in you?
My thesis was based on the proteins. There was a misfolded protein accumulation in brain that both in case of Parkinson's and Alzheimer's. In Alzheimer's, that is amyloid beta protein, and in Parkinson's, that is alpha-synuclein. Along with that, there is tau proteins, these things. So our lab used to work a lot. The one domain was these proteins, how they are synthesized, how the mechanisms, based on which they are accumulated in brain, or the clearance pathways of brain. That was the proteomic part. Along with that, there was a mitochondrial part. Now, this was a new thing I learned at that time, that majority of this neurodegeneration having one mitochondrial disorder. So in mitochondrial, what I can say, synthesis, biogenesis or degradation. Along with that, there are functions of mitochondria, where, as we all know, that mitochondria is synthesizing ATP, and that energy is given to the cell to conduct a lot of things. Apart from that, there are, ROSs.
I don't remember.
GNA.
I remember that mitochondria was the storehouse of energy in the cell.
Yeah.
And this much I do remember, that energy comes from that part, and it gives, if there are reactions happening, I guess, in the body, the mitochondria is giving that energy. Is it correct?
Yeah.
So what is the mitochondrial pathway of understanding disease? If you can tell us a little bit in a very simplified way.
That is the crux of the thing, that mitochondria is the powerhouse of the energy. But as I told, there are some reactive oxygen species, which is, again, if you remember, we used to read in biology that there are four complexes through which there are four complexes in mitochondria through which this now that is fifth complex as well. So there are five complexes through which there is the synthesis of ATP. Now, apart from synthesis of this ATP, there is also a part where again, I'm wrong.
ATP
Reactive
is the
oxygen
unit of energy, is it correct? ATP is
yes.
adenosine triphosphate or something.
Yeah.
Coming vaguely to my mind. So this is also the unit of energy.
Yes. So number one basic principle is, if there is anything wrong with mitochondria, the energy production will be less. Cells survive on this energy provided. Biological functions or the molecular functions of cells are hugely dependent on this ATP provided. That is the number one, and that is the very basic thing. When people thought about mitochondria, they used to work in this. If you remember, there is a TCA cycle, Krebs cycle was there. So the Krebs cycle used to occur inside the mitochondria. So anything happens to the Krebs cycle, the enzymes, these things hampers ATP synthesis.
Okay.
Now, apart from that, mitochondria is a part of a lot of other biological procedure. Amongst them, one is apoptosis. Apoptosis is the thing where cells, defective cells, if the cells anywhere are damaged, they are not supposed to continue to, they are better to be off, because they are already damaged. So if they survive, the damage will be persisting or spreading. So the clearance of those damaged cells are again taken care of by mitochondria. So that is another function.
How does the clearance happen? Just they become decreasingly active, the mitochondria?
No, the cells are totally degraded by apoptosis.
Okay.
Yeah.
And the decision comes from where? Like which
there are triggers. The cells used to release the triggers, which is taken up by the mitochondria. Then mitochondria releases some molecules based on which the cells are cleared.
Okay, perfect.
This is a very organized thing. It's just like in an organized way we clean our room. And that is a very organized thing which happens in our body. Unknowingly it happens in our body. Now, these pathways also, can be hampered. If the mitochondria is hampered, then these damaged cells will accumulate, will grow in size and number, and then they will spread the damaged proteins or damaged contents throughout the body. That is another perspective. Then some inflammatory triggers rises from mitochondria as well. Oxidative stress we talk a lot about these days that, these days I find everything is connected to oxidative stress or inflammatory stress. The mitochondria is one of the huge generator of these reactive oxygen species in our body. Mitochondria is what I can say, that is the balance between this ROS production. ROS is needed, in fact, in our body, but not
What
in
is
a huge
ROS?
amount. That is reactive oxygen species, the free radicals, or if they roam free, if there are free electrons, they will get attached to some other molecules who can donate or take electrons like that. So they will attach to the very common thing, the major thing in our body is protein. So they will attach to different proteins. The proteins will be modified. Now, in some physiological process, this is required. This modification of protein or destruction of the protein is required, like the process where we are having infections, bacteria or viral infection. So they are having proteins in their body. So this
ROS.
ROS, yeah. So
Reactive
this reactive oxygen
oxidative.
species, yeah. This ROS used to target these proteins and destroy. That's a good thing. We always want that these external organisms, they should be destroyed. But if they are produced in excess, then they don't know the discrimination between what is external and internal. So they can target the internal protein as well. So the balance is required, and that balance is maintained by mitochondria.
So the ROS stress is when they are getting created, and in the process they are targeting the internal proteins and causing a stress in the cell or in the mechanism or something.
Proteins as well, lipids, everything. The major quantity is protein, but again, lipids and many other things are actually damaged or modified by these ROS.
Okay,
yeah,
got it.
In fact, people age. The aging thing is a very good example of this oxidative stress. We all go through this oxidative stress. That's not a very pathological thing. It happens in our body. People's body are individually or specifically personalized way they are accustomed to deal these stresses. So you will see that many 80 years people, their skins are actually they are more wrinkles than others. Even between 2 8 years, there are varied skin wrinkling. These modifications are actually based on their body's adjusting power.
Okay. So when ROS is disbalanced in a way, then it triggers various diseases, because it can attach to certain proteins which can unfold in different ways, or it can change the functions of the protein. That's what you're saying.
It can do a variety of good things and bad things. So it can, destroy the protein. It can, as you asked, that how mitochondria will identify that this cell needs to be cleared. So when a cell is damaged, it sends trigger to mitochondria, and that is cleared. Now, if ROS is damaging a good cell's protein, it will be automatically cleared or destroyed. So there will be a good cell loss via this process. Again, few proteins lose their functions in a way that manifestation is in what I can say. People can develop diabetes mellitus. So this diabetes mellitus having one oxidative stress phenomena in their pathogenesis, type 2 diabetes mellitus, not the type 1. Oxidative stress is related to not only neurodegeneration. It is hard to find any disease where oxidative stress does not play any role.
Okay, understood. I am sorry to you. I must apologize to you and to the listeners for trying to simplifying things for my own head. But as we understood, it's not very simple. And of course, there are various different things, and ROS can have influence on and can get triggered by. So tell us a little bit about the research questions in the Alzheimer disease, that you started to talk about the mitochondrial pathway to that disease, and your interest in doing the research work during your MD. What are the questions you were after, and what encouraged you to go into this?
In my thesis work, that was a combination of Parkinson's and Alzheimer's. So we had three groups, in fact, in our lab. One group used to work in the aging model. Another was working in Parkinson's, and then a group was on Alzheimer's. So
I think at this
individually,
point, we should clarify for the listeners who are not into all these diseases to understand a little bit what are these diseases. These I can try to simplify, and you interrupt me when I'm wrong and correct me. Okay.
yeah, sure.
So these are the diseases that happen in the old phases of life. As you grow older, it can start from 40, 60 and higher, but the onset can be as early as 40 perhaps.
No, for Alzheimer's and Parkinson's, there are two varieties. One is the genetic variety, hereditary variety, where there is roles of genes. They occur early in age. It can be even 30s.
Okay.
But that's a rare pool.
Okay.
But the greater pool is more than 60 years. Initially, it was more than 70 years, 65 years, in fact. But now, when I was in my thesis time, it was found that, the survival of the people was getting longer day by day. More the age is there for survival, the diagnosis of the disease is found to be happening early. Even below 60, we can find this Parkinson's and Alzheimer's happening. For these Alzheimer's, I think many of the listeners know already that here we forget things.
Yeah, people forget, but it's not a normal forget things. Like people can forget things. I can forget things very easily nowadays also. but this forgetfulness has a difference, right? So it can happen that for those patients, what you are saying half an hour before, they can just forget the context and all the things discussed on the same day. Right? So these are serious forgetfulness. We are not talking about here and there where I kept my key and where is my
no, not at all.
Classes, not this kind of forgetfulness.
But again, the problem is there is another term known as, there are different types of dementia, actually. One of them is Alzheimer's. Now, the very common thing is senile dementia. With age, even people do forget. Now, the quote unquote term is neurodegeneration, where the neurons are destroyed. But again, in senile dementia as well, these neurons are destroyed. But the spectrum of these, with other dementias, Alzheimer's dementia is greatly different. Even after that, they are overlapping. Spectrum is overlapping. Yeah.
I see.
And for Parkinson's, that's a movement disorder. Even in Parkinson's, dementia can happen. But the major manifestation is movement disorder. You can see shaking of the limbs, we say tremor. So shaking of the limbs or walking very slowly. People cannot initiate the movement. And when they walk, after that, they cannot stop. If you give a point where you need to stop, they cross that line like that. So the control over the movement is lost, right? Along with that, abnormal movements are there.
Thanks for the clarification. I thought we should just say the definitions a little bit before going into the research. Yeah, please go ahead. You were talking about the research when
I started, observing these three groups. So mainly at that time, I was involved in these two teams of Alzheimer's and Parkinson's, wherefrom I extracted the question that these proteins, the abnormal proteins which are accumulated, this alpha-synuclein and amyloid beta, they are way of disease manifestation or the way of their molecular manifestation in the disease process are a bit similar. So I intended at that time to check how they are, these two proteins similarly or differentially, they are affecting the mitochondrial functions in the process.
So if I understand, if I take MRI of the brain, they would look different than a healthy individual in those patients. And then if Parkinson's and if I take Alzheimer's, there will be signatures in that MRI that will tell you can have signatures of these two different diseases by looking at the MRI, or you have obviously there are other processes, biomedical markers and all this maybe. Do you need combined results to do this, or just looking at the brain you can tell what is the
Now,
disease?
you will be honestly surprised to know, the very definitive way of saying a person is having Parkinson's or Alzheimer's is after death, where we were taking the brain tissue, and in that brain tissue, you are, checking that there is accumulation of these proteins at a specific region in a different scale. But definitely that is not the procedure of diagnosis. So now, why this neurodegeneration is still going on, research is going on, because as you said, MRI or CT, mostly MRI, they are having different signatures in MRI. But problem is the specific signatures when they are diagnosed, those are the very late cases. And now a disease has started around 60 years of age. It takes, in a natural process, it takes 10 to 12 years to come up with the MRI signatures. So by the time there is a huge neuronal loss, and neurons till now, the regeneration process of neurons are not yet properly established.
So there is no cure, right?
Currently,
Because
there
we do
are
not
a
know.
few. Currently, in Alzheimer's, there is an antibody, monoclonal antibody, which is in market. But yes, when you are diagnosed in a very late case, so it is very hard. That less number of neurons surviving, getting the quality life is very hard.
About the listener, perhaps in our family, let's say in my family, I have Alzheimer's disease, and people who have been detected later on, because also in India, a lot of times it's not reported and not getting detected. Let's say I have a family member who got detected, and I am very careful about my life choices and my lifestyles. At what age I should be getting regular checkups and regular, process of getting identified. If I want to get, let's say, I want my wish is to get detected as early as possible. What are the steps I should follow?
Hard to say, because again, if not a genetic thing, you can always go for the genetic analysis, whether when you are having somebody in your family, if he has the genetic variant of the disease, which means that person is detected very early in their phase, 30 years, 35 years, then there is a genetic pattern. Now, if someone in your family is diagnosed with 65 years, 70 years, that is, rarely a familial predisposition.
Okay.
Again, as I told that even without the familial predisposition, a lot of people are, in this neurodegenerative disorders. So the lifestyle is actually the good lifestyle, honestly. Good lifestyle in the sense the processes where you are trying to balance the aging is very much responsible to fight this neurodegeneration procedure.
Tell us a few factors that can influence this kind of lifestyle to balance this.
Number one thing is diet. You will see that there are, multiple diets which are currently running in the market. But for the aging persons, when you are these days, so 35 years, more than 35 years is considered as now you are in the process of aging. So start with antioxidants, start with different vitamins, check vitamins levels, vitamin D, vitamin C, E, these things. Then again,
B12 or B6 or something.
B6 is fine. B12 is also associated with neurons, but lesser studies are done on, dementia.
Okay.
So
How is the magnesium and calcium take part in this?
if you remember, regarding the mitochondria, told you a huge spectrum of the mitochondrial function. So again, in Parkinson's and Alzheimer's, and in aging as well, the normal aging, in these three, there are multiple domains which acts in a multifactorial way. If you suppose, if I omit the oxidative stress from the body, it does not mean that you are safe. There are other domains. So that is a combined strategy to handle these diseases.
Sure. So diet
Exercise
and supplements and antioxidants, all
and
these are
exercise.
important. And
Exercise.
exercise.
Yeah.
How much
These are the
exercise?
things are in your hand actually.
Yeah, but many people can give excuses saying that it's not in my hand. But let's not go to those people. Let's talk about exercise. What is the minimum amount of exercise that can signify a good lifestyle?
Honestly, for women, I will say for women, more than 30 from, if I say that aging starts from more than 35, for women, it is 30. From 30, the bone losses used to begin. Now, see, if you don't have time, only walk can help. Walking for 30 minutes, 40 minutes.
40
There are
minutes.
multiple models you will see, 10,000 steps, 5,000 steps.
Sure.
Anyway, but as a whole, apart from your, household chores, what you are doing, if you give a specific time for 30 minutes to 1 hour, that is a good habit. But when you go, nearly 40 or go beyond 40, here begins your muscle loss. So for that, you need to go for the strength training, a bit of strength training with 15 to 20 minutes is a very good thing. Yeah.
Thanks for going to the details of it and going to the questions regarding the lifestyles. I'm always interrupting you when you are talking about your research. So sorry for this, because it's so interesting for me as well, and I'm sure for our listeners. If I don't ask these questions, then they will be in my mind a lot of time going on. So again, let's talk about, you were talking about your experiences and your research field during MD, and we are circling around it for quite some time. What are the questions that were you asking at that time? Because I guess also you have to give context, as you are giving context, how this mitochondrial pathway and what are the processes and triggers that are the basics to understand the questions maybe you are asking for your research, right?
Yeah. So, the very established thing at that time in our lab was to check the functional parameters. So, functional parameters mean how well the mitochondria is working in our body. So, we used to check how much ATP is produced. We used to check how much there is a membrane potential for each cell. For mitochondria, that membrane potential used to decide how healthy a mitochondria is. So we used to check that. Then lately we had a system where we can study the live mitochondria. When you extract mitochondria, any organelle, they are live for a very few time. So at that time, how the different pumps are properly working in the cell, the membrane potential, or how much ATP is there, how much calcium is released from the mitochondria, how much the different complexes as we studied in biology, how these the enzyme functions are intact or whether they are affected in the disease process. We used to check at that time. Those are the available facilities were already there in our lab. Then I had an exposure. That was a good experience. In fact, I had an exposure from an Austrian group where from we purchased the equipment. So that equipment where we used to check the live mitochondrial functions that was added in our group later on.
Did you visit some of the places for collaboration at the time?
Yeah, and I have been to Obergurgel, Innsbruck, near Innsbruck. I have been there. Actually, before all these things, we had an international conference where professor came from Austria, and he demonstrated the whole equipment. He brought that equipment to India, and he demonstrated everything. Then we decided that we will purchase. We purchased that, and additionally there were some fluorescent electrode we were planning to purchase. For that I went to Innsbruck, where I learned the procedure, and that was a good collaborating group. Along with that, as I told, that I was working in the protein, I mean alpha synuclein protein. So there is one Australian lab where one of the professor used to synthesize this alpha synuclein in their lab, and he used to provide us that protein, based on which the 50% of my thesis was based on this protein alpha synuclein. So that was a good collaborating lab. Then in BHU, Banaras Hindu University, we had a good collaboration with them. Again, in Bangalore Institute of Neuroscience, where from we used to get the patients. So, I mean, that is a huge collaboration, because honestly, at that time, what I found that neurodegeneration working group was not that much hugely spread at that time, but slowly it grows.
I can imagine that also the interest in these diseases also, I guess, becoming more and more with the time, evolving with so many information available. And do you see people reporting it early on? Do you get greater number of people, especially in our subcontinent, where things are taken as lightly in the old age, saying that, oh, it's a normal thing to forget, and things are not taken care of very early, as you said. Also, patients come very later stage of life, when maybe to have a normal day, a daily life is becoming very much difficult to have. Do you see that there is a change in the patients coming earlier than before, like earlier phase of their disease?
Yeah, the one thing which has changed is the early manifestation of the disease, definitely. I mean, the age group has shifted from 70 years to 65 years. Currently, 60 years, under 60. I mean, a lot of patients are there. That is number one. Number two is, yeah, the awareness is now rising. As you said, that with aging, if you forget something, that's a general process of aging. But now people approaches doctors for the diagnosis, whether this forgetfulness is natural or not. And another thing, as I told, that MRI, initially the MRI detection of these diseases, they were in very advanced phase of diseases. Currently, there are a few, I will not say a lot, a few facilities are there where comparatively early diagnosis can be done. So modalities are developing, yes. Then awareness is developing, and also the practice of diagnosing Alzheimer's disease are on now.
Okay. I was reading a little bit for this podcast episode, and a little bit to get acquainted with your research on Alzheimer and everything. And you mentioned a couple of things, like precaution is the best. We know this. So, and you mentioned that lifestyle, diet, in the sense of exercise and diet, are very important. I also read a little bit about taking cognitive load as a individual as you are growing old. If you're learning new things, if you're interested in reading or writing or things like that, it also helps a little bit. Could you tell us a little bit about that? How does this help, and like what is the actual process happening with this? So when these diseases, on the onset of it at least, these proteins are getting modified, the amyloid beta, or what is the other one, alpha
synuclein.
Yeah, so those are, let's say, those are getting accumulated in the brain, and in a normal individual or healthy individual, those will get cleared out in certain way. Is this the process when we are having a good lifestyle that they are getting created, but they are getting cleared out eventually, or something more is happening?
These proteins in healthy persons do exist. I mean, amyloid, say alpha synucleins. Those who are not having Alzheimer's, even they are having these proteins in their brains or circulation. The difference is the expressions of this protein. As I told, these are the misfolded protein. Now, the proteins which healthy persons are having, they are properly folded protein. Now, protein folding, if I say a bit that if we have a long chain of protein, say, I mean, in between there are different cuts or different domains where they are folded. So if they are not properly folded from a very specific region, or if they are cut in a wrong region, they are creating this misfolded protein. Similarly, if the environment where the proteins are getting folded, if that environment is hampered, again, this protein folding is hampered. Finally, what comes out can be a normal protein, can be a misfolded or abnormal protein. Now, even in healthy persons, in physiological process, a bit of the abnormal proteins, because a physiological process cannot be 100% perfect. So the errors are there, but the amount is very low. That is regularly created, but in a very lesser amount, and the clearance system is, I mean, good in a healthy person. But in a diseased person, the load is higher, the misfolding protein synthesis is higher, as well as the clearance system is damaged. So
okay, understand. Thanks. So then does the lifestyle choices and also all the cognitive and active cognitive pathways until a very old age, does it help in the clearance, or how does it help basically, or is it also complex, different factors and different?
it is complex. I mean, because these are age-related diseases, it is very hard to unless there is a genetic variant, it is very hard to discriminate the very specific trigger. We always say these are the multifactorial diseases because there are multifactorial influences from different sides. Along with that itself, aging is we are exposed to different abnormalities throughout our life. We keep accumulating those things and finally they manifest. Say it abnormal diet. If you eat 10 rasgullas in one day, you will not develop diabetes. That's a habit of developing something, genetic variant of developing something. So these loads when they are put for a long time,
Constantly,
finally they accumulate and manifest. So if you think that now I am forgetting the things, so I will practice the good lifestyle and good habits, good diets now, that is not the time.
But that can actually, okay, that's another question then. Yeah. If I realize, can it decelerate the progress? I mean,
yes.
If you say that that's not the time, then people will not do anything. my body is, but it does help, even if you intervene at a later stage about getting conscious about your lifestyle, it does have an effect of decelerating. Maybe it will not cure, as you are saying, right?
Yes, as I told, because neurons do not yet, the regeneration powers are very low in neurons. So once lost is lost. That is still, the regenerative medicine in neurons, yes, they are still under research. There are multiple things, but as a whole, that is not a very established thing that neurons are now regenerating. So once you have lost the neurons, if you start your all therapy, all habit, you may delay the further loss, but the things which are lost are lost. So if you start from very early, you can delay the preliminary loss. That's it.
Yeah. I guess getting aware of things is the most important right now. And this I didn't read, but my curiosity is creeping up. Is stress, normal stress, having stress in not the chronical one, does it also have an effect in individuals?
Yes.
Neurodegeneration. Okay.
So, stress can be a manifestation of your underlying. See, stress is there. healthy, unhealthy lifestyle, stress is there. The habit of handling the stress, that depends with individuals. So, if you under stress, if you lead a stressful lifestyle, it will affect.
It's like some stress are required to perform in day-to-day life. I think if you do not if you are cool about everything, then I guess not a lot of things get done if if you have a chilled approach. But the stress where your everyday normal life is getting disturbed, like your diet habit is getting disturbed, you are not going to exercise or doing anything, living a sedentary life because of the stress.
Yes.
Those are the bad things.
Also, the hormones are there. They also influence the physiology of the body.
Talking about hormones, I have also this thing. Do you have an understanding of the effect of gender on Alzheimer or Parkinson's? Because the hormones are very different in male bodies and female bodies, and the way they decrease, and at certain point all the female hormones also are decreasing at 30, 35 or 40, depending on the body. Those things affect neurodegenerative diseases or any pathways. Are there data or research?
There are data. Actually, women health concerns are different when they are postmenopausal, perimenopausal, postmenopausal. They have the lesser efficiency of handling stress, or molecular level stress or other stress. So postmenopausal women, they are quite exposed to this inflammation or oxidative stress, like that. They are having this manifestation, definitely.
So what can one do? Again, back to lifestyle choices, right?
Say lifestyle and diet. Lifestyle includes diet, includes the sleep pattern, includes the daily activities, exercise, etc. As a whole, the lifestyle, you'll say smoking, alcohol, these are all are part of lifestyle. So the good lifestyle definitely at the molecular level has great effects, which manifests in later life. So the early lifestyle you adapt, that will be reflected in your aging life, definitely, if not early.
Good to know, and good to get into the mode of implementing all this, because
That's my point as well. I might speak a lot, but then again, how much I adapt, that is also under consideration.
Yeah, but I think data are coming, so I think one had to take conscious decisions about all these things. I would like to know, circling back to your career path a little bit, after your MD in biochemistry, you also did DNB in biochemistry.
Yes.
Why did you make the choice? What was the decision, and what extra did it give you for your career above MD?
Honestly, nothing extra. What happened after passing MD, I entered in medical colleges. One medical college, and I started my teaching as well as side by side research, teaching, and then diagnostic laboratory work. That was a static thing which was happening in my life.
How do you balance all these things? First, tell me. It seems to be a lot, and not static from the point of view of our listeners and me. First of all, you mentioned three duties: teaching, your practice, and research. How did you balance all this?
Honestly, that's an established way. When I was I have been student, I have seen people doing the same thing, because in medicine field, probably research is not mandatory. But then again, teaching in medical college specifically, teaching as well as the patient service, they are the integral part of their responsibility. And definitely, which has in India, in fact, I'll say in India, that is not a time bound thing. It's a habit of balancing, because definitely I have my hours of duties where I am doing my works. Others are there to balance the things of that. We used to share. We have colleagues. We have interdepartmental collaborations. It's not a collaboration of research. It's patient service collaboration. So these are the things naturally happening. But
Yeah, I was
then
joking when I said, but from our point of view, it's not stationary, static at all. But yeah, but you
but then
felt in a rhythm and in a practiced way you
yeah.
wanted to grow, perhaps.
And then I thought, my personal level of study, I realized actually I did DNB, in fact, a bit later. It was post COVID. So in COVID, coincidentally, in the COVID period was my maternity leave. So in both way, my life was very static when I rejoined the duties. Then again, the post COVID drive was a slow life. So at that time, I was thinking of doing something apart from this regular duties. So I did a few courses. Along with it, I decided that let's do the DNB like that. So what new I have come up with this DNB thing is, by the time I did DNB, the courses were greatly modified. So I was exposed to those things, which was a very interesting thing at that time.
What were those surprisingly interesting things for you that you got exposed to?
Actually, what I found that the molecular diagnostics of my interest, there were always in field of medicine, things are developing very fast and in very varied and multidimensional way. For me, the interesting thing was that molecular diagnostics in India specifically, the practice of molecular diagnostics are rising and faster, and the equipment, the high-end equipments are the purchase in different government hospital. Of course, the private or the high-end diagnostic centers, they used to have those things, but again, the government hospitals are getting equipped with these molecular diagnostics. The patients are coming up to get diagnosed for different metabolic markers, different genetic markers. These are, the concern or the awareness are getting higher.
Yeah, it's good to see this, the way things are evolving, and hopefully it's evolving in this way around the world. So after a couple of your professorship position in Durgapur and Kishanganj, you got hired in the Dr. B.C. Roy Multi-Speciality Medical Research Center at IIT Kharagpur. What triggered you to take the decision to move, and what is that multidisciplinary environment like engineering, which is IT specialty, but now with this medical field, what that environment give you particularly?
At that time, Kishanganj was in Bihar, so I was finding a way out to come back to West Bengal for getting my son quite younger at that time. So I can avail my family support. So I was, finding a way out. Incidentally, at that time, this IIT Kharagpur's advertise came up, where we heard that one medical college was about to come up in IIT. We were waiting for that because, of course, this renowned institution, they will be coming up with a good thought. Then we get the opportunity. Now, as we are working, I was not aware, though many of my friends were aware. So one department was already there who were working in the medical researches at that time. So it was not a very hard or new situation for IIT to develop a healthcare system. But yes, the medical college, the teaching medical institution, that is what I can say, that's a tough procedure, I'll say, because there are difference in the setup, difference in the infrastructure, difference in the administration. So because these things are different for a teaching hospital, that is a process, still it's still under process. But otherwise, health related research, health related activities, patient care, yeah, when we joined, a pool of doctors when joined, my colleagues when they joined, the process day by day, it is getting smoother. Otherwise, it's a good environment where we are getting in touch of the engineers, and they get to know what we actually need. Accordingly, they are developing things. We also can express the lacunae where we are facing the challenges in patients' diagnostics or patients' therapeutics. So it's a very, symbiotic process, I'll say. Yeah.
Very nice. Are there any challenges of setting up early career research in medicine in India, and how do you overcome those?
Honestly, they are still, apart from the very renowned institutions in India like AIMS, like PGI Chandigarh, or I'll say BHU, the research facilities here are really tough. What happens, for diagnostics, number one, the funding is definitely required for diagnosing this pool of patients. High-end equipments, as I told you, due post-COVID, I am seeing that yes, the government hospitals are getting equipped with quite a lot of high-end equipments for diagnosis. But otherwise, availability of these equipments are not that much. There were many hospitals or many medical colleges in India. The primary target or primary goal of these institutions is number one, patient care, the primary load handling. After that, if you get time, if you get opportunity, or if you get the funding, most importantly, in that case, you can proceed in research. So half of the strengths, I think, are gone providing this patient care. After that, if you have left with something, then you can invest in research. So that is number one, the time and energy and opportunity. And number two is definitely hospitals. Apart from 10%, I'll say 10% of the hospitals, other directly patient care associated hospitals are not hugely equipped with modern high-end diagnostics. That's the problem. So if you want to, for the doctors, this is a sort of suggestion that if you want to work, you have to collaborate.
Which might not be a bad thing, but that one should keep in mind also
Yes,
to network and also to have that outlook from the very beginning, right? Thanks for the tips. Coming back a little bit again on your research, you were also talking about a little bit new developments in the areas of this neurodegeneration, but also your work is now getting focused on muscle degeneration.
Yeah.
Can you talk about these new research areas of yours, and what are the diseases that you are considering right now? Are they still neurodegenerative diseases, or you are being diversified?
It's a sort of diversification, I'll say. Actually, I started with this mitochondrial abnormalities. I used to check a lot. Because I have the facility of checking the mitochondrial health or mitochondrial physiology, pathology, whatever you say. So I used to check, whether these abnormalities are confined with these age-related diseases only. So in that case, I still had discussion with my group where we found that a lot of research is currently on the muscle degeneration. Muscle degeneration in sense that, as I told, that you will see with aging, there are wrinkles over the skin. Then if you picturize in your mind that a very old age, you will see they are bent up, the skins are as if shrunken. So underlying cells are getting degenerated. Also at molecular level, the fiber quality, muscle fiber quality, they are getting changed. There are a lot of researches are going on whether that is getting triggered by mitochondrial abnormality or not. From there, I started my journey on muscle degeneration. Then we developed a group who are working on the now another thing is very important. I'll add to this that this muscle degeneration can be physiological. With normal aging, you will see this type of muscle degeneration. Also a group of diseases like cancers, then diabetes mellitus, or there are other pool of diseases where also in early ages you will find this muscle degeneration. So this primary and secondary muscle degenerations, we have a group where we are checking whether they are affected by mitochondria. Along with that, there are inflammatory triggers, whether they are affecting or not. Yeah.
Sorry, go
Yeah.
ahead. I will ask later.
No. You can add.
I was asking whether muscle degeneration itself can cause inflammation, like especially, let's say, for aging women after menopause, post menopause, there is a, or perimenopause phase, there is a lot of muscle degeneration. Does that affect the inflammatory processes in the body? Does anybody have to take a special care on those front?
If you see a person who is obese, so you will think as if the mass is higher. Definitely the body mass index is higher, but that does not mean he or she is having the higher muscles. They are having higher fat content. Yeah. So what happens? The muscles are replaced by these fatty adipose tissues, or the quality of the muscles are poor to properly contract or like that. So in postmenopausal women, what happens? They accumulate this inflammatory and oxidative triggers inside their body that affects the proteins, as I told you, the lipids. And in muscle, there are a huge amount of proteins in muscle fibers, and so in a way they are also affecting the muscle health. And along with that, that happens to everybody. That is the common scenario. Along with that, the hormones in postmenopausal women, they are also affecting, because there is a total change of the scenario. So in that case, they are also affected. Yes.
So that enhances the possibility of getting inflammation in the certain parts of the body.
Yes.
Or
In the whole, everywhere in the body.
Okay. Wow. But you were talking about all these effects that muscle degeneration can have in the body. And then what are the research areas you are considering?
Currently, I am having some in vivo and in vitro models where I am having molecular level parameters where we are checking the mitochondria as well as the inflammatory parameters. That's an in vivo and in vitro model. Apart from that, we have a population, urban and rural population here. All the medical colleges do have actually their own urban and rural population area. So in those population, we are screening the persons who are having the muscle degeneration based on there are certain, fixed questionnaires and certain clinical assessment. Based on that, we are checking the group of sarcopenia, and then there are different parameters we are checking, molecular level biomarkers we are trying to develop, as well as we have a community health group here, public health persons I have in my team, and she is also developing modules for intervention based on diet and lifestyle to check the reversal of these processes. So that is the current phasic work we are in.
So basically, these can affect very many areas of the life, and also it can trigger many diseases, muscle degeneration itself, right? And therefore, to focus on this is important before, to catch them in the early phase if the diseases are happening.
Absolutely. Yes.
That's the goal. You also talked about your work on adolescent health and your research around that area. Can you talk about what are the questions that are most important in this field?
Now, adolescent health, currently I am quite interested because I am also reaching the women health domain currently. So the women health is a very current growing interest in me where I want to work. So I started with adolescent because somehow I have been in contact with this adolescent group of people, and I found out that what I can say, the lifestyle of them, the stress level of them, mental health are quite a part in this adolescent group, which in adolescent they are manifesting a lot, and that is having a cumulative effect in their future life. So also the metabolic health of them.
Is it related also a lot of increased screen time in those age area?
Yes.
Age group.
Yes, absolutely. Increased screen time
Screen time,
itself has some effect in the cognitive level, definitely. Along with that, the additive things are, I mean, when kids are more into the screen time, the social development are less. The constant level of interactive
Dopamine.
screens, yeah. So they are, in a way, incapacitating them to work in the real scenario. So the real stress the normal stress we were exposed, they are quite greater to them.
Yeah.
So that's a thing, definitely, that's a thing.
Okay.
So
And
my current concern is the metabolic and mental health in adolescent group. So that's a purely, currently the epidemiological survey based activity we are having. So we are checking in our region, what are the concern, public health concern. Based on that, we will subdivide our group. But definitely one of them, as already identified, one is the mental health thing, the depression or stress levels are quite higher, as well as the metabolic health.
what is a decreased metabolic health at an early age, an adolescent, mean for this age group in a later life?
Yeah. Now the thing is that there are genetic manifestations. So your genes manifest. That's the thing. But again, if your gene can manifest, you have the radar to channel the genes to the proper way or handle those activities in a proper way. Number one thing. Number two thing, currently metabolomics, not currently, it's been running since long. So these metabolomics are quite a trigger to, handle the molecular functions in our body. Again, I'll come to the lifestyle and diet. If you put the bad things in your circulation, that will accumulate, that will manifest, that will have a cumulative effect later on. So based on the current, what I can say, processed food intake, based on the current crash diets, these are the things which are actually disbalancing the body's physiology.
And also there is a role of sleep, right? The amount of good quality of sleep that is very much overlooked, especially at this age group. I think when you are young, you think you don't need that much of sleep and you can get away with it, but it has a downside effect if it's consistent in a later stage of your life.
Yes.
Right.
So honestly, sleep is the thing. No, there is no age group which will not need a good sleep. Most importantly, it's a plug point to your body, which gives the energy, which gives you the phase where you can restore all your body for the next level of stress. Now, the screen time or the lifestyle now is a factor which affects the sleep of all the age groups, I'll say. From the kids to the aged, the screen time is definitely affecting the sedentary lifestyle. Sleep is affected at aged people, definitely. That's a normal procedure. But again, it is triggered by this screen time, the lifestyles, all these things.
Thank you for discussing all these, and eventually we understood also a lot of why it is important. People do talk about the lifestyle changes and why these factors are so important: sleep, diet, exercise, and less stress. But through this conversation, we had a better understanding of this. Next, I do want to ask you one related question. You have a recent paper about AI and especially AI, role of AI in academic medicine, in higher order performance or complexities in answering all these questions. What triggered you to first of all write this paper? I have read it, not the whole paper, but it seems that you are promising that it's going in the right way, at least in answering some of the questions. What is your perspective on using AI for clinical academic research?
See, one most important thing is the AI is phenomenal these days, honestly. But where to use and how much to use is the concern. I am seeing patients who are having different informations or different guidance from the internet, chat GPT, or any type of the AI tools which are having now. Some of them are not wrong, I'll say. Some of them are it's totally wrong again. But when we are talking about some established thing which are having in the domain in the internet, so from that studying through AI is not a bad thing if you check the reference. Most importantly, if you get the good and proper reference, studying through AI is, I'll say, rather by means of effort, this is a good way. I support. But again, when you are going in practice in real life, you actually must have a lot of examples. You cannot just go by AI. Then again, in medicine, I'll say there is a term currently running that is personalized medicine. I mean, with the same problem, you and me, we are not having the same way of treatment because we are the two different persons. Our bodies are different at physiological and molecular level. So therapies are extremely designed at the personal level for specifically for you. So for these things, AI is not a good thing. But considering the load of number one, as you asked regarding academics, for academics, when there are established books or articles which are already available in the portal or in the internet, based on that, AI can definitely can give good answers. The trouble of searching very little things in book, that's my personal opinion. You can avoid those things for extremely established thing. But again, for personalized medicine, you need to design your own. Now, if I talk about AI in real life practice, developing algorithm is one thing which I'll say which will ease your way through differentiate between what is easy and what is tough. Means when somebody is having fever, I'll say. Now, for having a simple dose of paracetamol, you don't need to go to a specialist. Similarly, developing an algorithm which can give, if this ABCD is there, then the treatment modality or the diagnostic modality is this. So this can ease the load to the society. That's it.
But does it not also increase the wrong self medication? Because my fever can come from anything.
Yeah.
I may not have, and it also goes to self analysis a little bit. Because when the doctors ask me, maybe I am aware of these things happening. Otherwise, when I'm self medicating myself, I'm just considering a few factors, and that's in the forefront. But other factors I am not considering, which is an expert in the field only can
exactly
make the connection.
That is why you need the algorithm where you will there is a pool of questions, pool of primary questions you will answer. Based on that, the decision will be taken by AI. Of course, the tool has to be validated. Most importantly, it has to be validated. So as you told that your fever can be from some type of infection. The very early manifestation is fever. So in that case, definitely the tool should be that it will ask few questions regarding what are the other symptoms you are having. Whether you are having any exposure or not, any other manifestation. Based on that, you will answer 10-15 questions. Then it might suggest you that you go for this 2 days paracetamol or 3 days paracetamol, even if the fever intensity frequency does not subside. In that case, you approach the doctor. So what it helps is basically investing in your, when you are having fever, investing 1 or 2 hours of attending the OPD time and getting additional stress, that you can avoid. But again, it is not replacing your physician. It cannot. It only is, give a comfort scenario to both the doctor and the patient.
The bottom line is it's not replacing a physician, and
no, it's not, never.
do not go into the extent of self-medicating yourself. That can trigger other things for the long run. So as you were saying that in the countries especially where the loading is too much, I think this is important, like countries like India and the other countries in the subcontinent. This might not be the case in certain countries in Europe, and also it might apply to the US, because I have also heard the waiting time to get an appointment is also long. So in those cases, perhaps it's very country specific and situation specific. But whatever it is, the bottom line is it does not replace your physician.
But also another problem is, I mean, there are so many tools. It's confusing which tool you need to believe.
Sure.
That's the problem.
Sure. My problem with this is that before ChatGPT also, I used to know people who used to love to self-medicate, and like you used to consider themselves a doctor without a MD or MBBS degree. In those cases, the situation can only get worse. My only concern is that, especially with the help of AI now.
I mean, that must not be, as far as I know, that must not be a problem in European or US, because I mean, the available over-the-counter drugs are very less there.
Yes,
whereas in India, quite a higher amount of medicines are over-the-counter available.
Sure.
That is the problem.
That's another factor. That's true. You cannot just go and buy medicine here in Germany. There are so many things you can go from here, and so many interesting questions. Thank you for answering. So many interesting questions are coming in my head, but thank you for answering my stupid curiosity and sometimes some trivial questions. But let's go from here, a little bit fun segment. We talk about some trivia about yourself, and then I will ask you a last question before letting you go. Okay. So what are your hobbies?
My hobbies are changing. But I had the hobby of music and dance. These are my two loves. I used to nurture them by listening to others, by singing by myself, again, by watching others dance. I do dance as well. So these are the two constant hobbies. I can give time or I cannot, but I enjoy. Then again, being in West Bengal, the cultural parts are quite rich. So watching dramas, I get the opportunity currently to watching different dramas. But again, singing and dance, I'll say these are the major things. So I'm interested. I do practice.
That's nice. Very nice to hear that you can still cultivate those
If you remember, we used to do a lot in school as well.
We used to do a lot. We especially the Teachers' Day, and also the annual day and everything. But also Teachers' Day was a very personalized things for. We used to do it by ourselves, not organized by school authorities.
And there are trivial things. I mean, as far as I remember, there were cultural segments were there in different phases in school. So we used to have this fun always.
Even if the period was off, in the sense that the teacher was absent for some reason, we do something, singing or something, one person will sing and others will listen. And we also did also make noise a lot. Let's not talk about all the secrets. What do you read books? What are the books that had impacted you in a deep way?
I honestly, since my childhood, all the thrillers type of things I enjoy a lot. Even different web series, whatever available books and web series, over thrillers, over mysteries, I love them. Currently, I'm reading some life lesson books.
Or self-help books or biographies?
Both.
Okay.
This time, at this phase, I'm getting very less time.
True, I can imagine.
In fact, these days, I mean, I am quite into Ruskin Bonds, children's books.
Yeah.
I need to deload my brain.
That's a nice way to de-stress and declutter your
Yeah.
mind. What are the languages you speak? How many languages do you speak?
Honestly, I am Bengali, English, and Hindi are my primary things. I'm not a very good Hindi speaker, but yeah, I can manage with that. I started German, as I told you, German. I started it, but at a very basic level, I'll say.
German is a difficult language. Even
True.
after living here for so many years, I still struggle. The other day, I got a missed call on my phone, and I called back, and it was my neighbor, and then I have to converse the whole thing in German. If it's sudden, for me, my brain has to choose between German, then second level of alertness. So it's not. Italian came easy when I was in Italy. Italian came easier than German, but German. But you should keep on doing it. Next time, maybe we can speak in German.
Yeah, yeah, I'll try.
At least my son will speak to you in German.
Even my son is better in German than me, definitely, I'll say.
Wow. But the children's brain is like a sponge. They
Yeah,
just can
language
pick
is
up like 3-4 languages simultaneously and have no problem with it. It's
again,
our
that's a study.
neurodegeneration happening in
What happens? So, language is the higher order of. If in your childhood, another thing, in your childhood, if the brain is learning multiple language, that is a sort of cognitive development happening, neural interconnection that can help you in, fighting many of the diseases because your neurons are getting healthier by that. And that neural interconnection, I recently have been through one presentation, very nice presentation, I'll say. So there I learned, learning 3-4 language, why it is definitely easier in kids, and why? Because their brains are at the phase of developing new neural connections, which is not, comparatively much lesser in us. If
what
you remember,
happens when an adults try to learn more language? Does it help
it takes
them
time.
in a way?
Of course, it helps them definitely, but the proportion is quite lesser.
Totally, yeah. That is understandable.
Yeah. So,
But
for cognitive improvement in, aged patients, say dementia patients, say Parkinson's, whoever, where we want the neural health. These days there are different mobile-based or web-based games where you can improve your cognitive functions. So,
okay.
language is one of them.
Very nice.
Yeah.
Very nice to hear. I should never give up on learning German then.
For me, learning more German will increase my stress level sometimes, I think.
Who are your role models whom you have met, and you can be your family members, friends, teachers who had impacted your life?
Of course, my father and my mother, they are one of them because they actually set the vision of me towards the life, towards choosing the pathway of my life, definitely. Then again, I'll say my friends play a lot. My colleagues, my friends, they always play a good role by providing me a good environment, which is very much needed. Say it's school, I'll say myself very lucky because in school, in colleges, in my previous working fields, I got those friends or colleagues come friends. They provided me the good environment, which is for me, which was very much needed to handle or cope up with all the stresses.
Mm-hmm.
So I will not say they are the role models, but yes, they have been the support system. And in medicine, I'll say my guide till now, he still gives me directions to work. We discuss a lot in depth what the not even in the research or in our domain, what the proper lifestyle would be, how the research line can be, how the medicine line can be modified, what are the life goals or what are the modifications needs to be there. So in a way, he plays a great role in my life.
Can you give a shout out? What's his name?
Professor Shashanko Chakraborty.
Thanks. Do you have a social media, LinkedIn, or anything that if our listeners want to be in contact with you, they can reach you?
They can go through my LinkedIn profile. I have in my name, Aritri Bir. Then my institute profile is also there. So they can come up in IIT Kharagpur's website. They have a
I'll
detailed
put the
profile
links.
there.
I'll put the
Yeah,
links
sure,
in
sure.
the description box.
Yeah. Also by Google Scholar, through that, if they want to see the way of, the researches or the works I'm connected with, they can go through those as well.
Thanks. All the links will be provided in the description box or in the show notes. One last question. What is the biggest challenge that you faced in your career going through all these phases? And if you have to advise your younger self now, your current phase wants to give some advice, what advice should give?
From the very beginning, I'll say what I have seen in medicine and current scenario, that there are a lot of opportunities. If you lose one, you will definitely get one if you try to find out. So fighting depression or fighting that as I have lost the opportunity, there do not stop. These days, there are a varied way where you can come to know that you can work differently, even if the way you have not thought for. So don't stop. If I want to give any advice to my younger self, is this one only, because I have been through different failures. So there I took a lot of stress. Definitely I came out, and there I knew that that much stress taking was not worthy at all. In medicine, even your life is stressful, you must come out with some enjoyment, some social life. That is the way where how you can fight things.
Thank you. Thanks, Aritri, for sharing so many tips, your life stories, and your journeys. I'm really hopeful that our listeners will learn from this conversation, take various tips, because we have talked about how to avoid certain diseases by leading a good life. And you gave a lot of tips how to do that. And also to understand, be aware of different diseases early on so that you can do your bit today. Thank you for your time. And as always, I think you had been, talking about role model, you have been a role model for various reasons in school. And because you were one of the toppers, we used to look at you and learn different things. But that, I think, a lot of people will say in the school. What I remember particularly is that you were very generous with what you were learning and sharing. And that had impacted my life in a great way. I hope I did with others later what I learned, seeing you, that its knowledge is only gets bigger by distributing. So thank you for that person, being that person all your life. And thank you for being here today.
Thank you. All of us, thank you. Bye-bye.
That was my conversation with Dr. Aritri Bir, a discussion that moved across medicine, research, neuroscience, lifestyle, and healthcare. What I enjoyed about this episode is how Aritri connected highly complex biological ideas to everyday life. We often think about the neurodegenerative diseases such as Parkinson's and Alzheimer disease as something distant or purely medical. But Aritri reminds us many aspects of the future brain health are shaped by today's lifestyle choices through stress, through mental engagement, through sleep, and overall health habits. One of the strongest themes throughout this conversation is how the medicine is more like not only treating the disease when it appears, but also understanding how to prevent the disease itself, and how AI-driven healthcare can reshape the future of medicine and education. We also explored something deeply relevant for all of us, how lifestyle choices today can quietly shape the future of our lives many years later. If you enjoyed this episode, please like, comment, and share it with someone who might find it beneficial. And also do not forget to subscribe to the channel so that you don't miss any future episodes of the DPD podcast. As always, you can find the links to the topics and places discussed in the description box below or in the show notes. Until next time, keep exploring, keep questioning, and keep learning.